Hello everyone, this is Hussam. I am going to teach you BE544 Artificial Intelligence Techniques in Digital Histopathology, and this is lecture 1. As you see in the title of the course, there is something named Digital Histopathology. Let's understand the meaning of it. There are different diagnostic tests that are applied by radiologists, pathologists, and clinicians, doctors, and many people to diagnose the patient. It can be partitioned into pathology and radiology. So, pathology mainly is a part of the diagnostic tools or tests. It aims to study the diseases, their causes, mechanisms, and effects on the structure and function of organs and tissues. It involves the examination of specimens, and we are going to understand the meaning of specimens in the following slides. Specimens such as tissues, cells, and body fluids. The aim is to diagnose the diseases and understand the underlying processes. Pathologists analyze these specimens to analyze and identify abnormalities, characterize the diseases, and provide insights into prognosis and the treatment options. Also, pathology can be partitioned into subgroups: clinical pathology, such as microbiology and biochemistry, and anatomical pathology, where histopathology is part of it. So, what is histopathology? Histopathology is a specific branch of pathology that focuses on the microscopic examination of tissues to diagnose diseases. It involves the study of tissue samples obtained from different things such as biopsies and surgeries. Histopathologists examine these tissue samples under a microscope to identify cellular and tissue level changes associated with various diseases such as cancer, infections, inflammation, and autoimmune disorders. So, pathology focuses on the study of diseases, causes, and mechanisms, while histopathology focuses on that, but under the microscope. So, what are microscopes? Microscopes are tools used to magnify objects that are too small to be seen by the naked eye. Commonly, they use light rays through lenses to produce and enlarged images. As you see, you put the specimen or the object and fix it here, and through the eyepiece you can see an enlarged image. There are different types of microscopes. The most common type of microscopes are light microscopes. They use visible light to illuminate specimens and magnify them. Light microscopes can be partitioned into 4 subcategories. The bright field microscope, as you see in the first figure, it provides a bright background against which specimens are viewed. Phase contrast microscopes, as you see in the third image, they enhance the contrast of transparent specimens, such as cells without the need of staining, and they are recommended to observe the intercellular structures. Dark field microscopes, they create contrast by illuminating specimens from the side, causing light to scatter off the specimens and appear bright against a dark background. They are useful to observe live and unstained specimens such as bacteria and parasites. And the fourth one is fluorescent microscope. It's used to visualize specific molecules or structures within the cells, and it uses fluorescent dyes or proteins to do that. The second category is electron microscope. Instead of using visible light, it uses a beam of electrons to magnify the specimens. They offer much higher magnification and resolution than light microscopes, making them invaluable for studying ultrastructure and fine details of cells and tissues. Electron microscopes can be further divided into TEM, transmission electron microscopes, and SEM, scanning electron microscopes. TEM transmit electrons through a thin specimen to create a detailed image of its internal structure, as you see in the first figure, while SEM scan a focused beam of electrons across the surface of a specimen to create a detailed 3D image or 3-dimensional image, as you see in the second figure. So, there is a microscope that's used to magnify specimens or objects that cannot be seen by the naked eye. How this is done? There are 2 lenses in the microscope: the objective lens and the eyepiece or ocular lens. So both of them are essential components of a microscope that contribute to the overall magnification of the specimen being viewed. The objective lens, as you see in the left arrow, it's located close to the specimen, and it's responsible for gathering light from the specimen and magnifying the image. There are multiple objective lenses with different magnification levels. As you see in the figure, each of them can hold a different magnification level, such as 4x, 10x, 40x, and 100x. While the ocular lens, or the eyepiece, as you see in the left arrow, they are located at the top of the microscope, and this is the lens where you look at. It further magnifies the image produced by the objective lens. Eyepieces, or ocular lenses, commonly have different magnification levels, such as 5x, 10x, or 15. So we have two different magnifications, one from the specimen, which is called the objective lens, and the other magnifies the output of the objective lens using the ocular lens or the eyepiece. So assume that if we have an objective lens of 10x and we have an eyepiece with a magnification level of 5x, how can we calculate the total magnification level or the magnification value of the specimen? To calculate the magnification of a microscope, you need to know the magnification of the objective lens and the magnification of the eyepiece or the ocular lens. The total magnification is the product of these two numbers. So the total will be the magnification of the objective lens multiplied by the magnification of the eyepiece. So as you see in the left figure, this objective lens is 10x and this ocular lens is 10x. So the total magnification will be 10 multiplied by 10 will be 100. So assume if the objective lens has a magnification of 40x and the eyepiece has a magnification of 10x, so the total will be the multiplication of them will be 400. This means that the image viewed through the microscope is magnified 400 times larger than the actual size. This is very simple. To go deeper, to calculate the value of the magnification of the objective or the eyepiece, there are two approaches. There is a linear or simple approach and there is an exact approach. So as you see here, we put the specimen or the object at point P, and as you see, this is the height of it, and we have an objective lens and eyepiece, and through looking the eyepiece, the object A is magnified with that value. By doing that, we have three values that can be used to calculate the magnification of the objective and the magnification of the eyepiece through using them. The first one is the focal length of the objective, and this is the length between the object and the objective lens, and this is noted as FO. Another one is the focal length of eyepiece, and this is the length from the eyepiece to the looking point or the eye. And the third one is the length of the tube, noted as L, and this is from the end of the focal length of objective and the end of the focal length of the eyepiece. By using the three values, we have the magnification of the objective, MO, is the length of the tube, L, divided by the focal length of the objective of FO, and the magnification of the eyepiece, ME, is the least distance of distinct vision, and this is a fixed value of 25 centimeters divided by the focal length of the eyepiece, FE. So simply, if L is equal to 30 and FO is equal to 40 millimeters and FE is 50 millimeters, then MO is 30 multiplied by 10 to convert from centimeters to millimeters, divided by 40, which is FO. This will be 7.5, and ME will be 25 multiplied by 10 to convert from centimeter also to millimeter, divided by 50, and this is equal to 5. Now we have the magnification of the objective and the magnification of the eyepiece. So the total magnification, as we saw in the previous slide, it's a multiplication between them. 7.5 multiplied by 5 will be 37.5 times. And this is the linear or simple approach. What about exact approach? To calculate the magnification of the objective lens and the magnification of the eyepiece using the exact approach, there is a long derivation that can be accessed using the first reference, This is a video that illustrates the derivation of the rules we are going to use. It concludes that the magnification of the objective is the length of the tube minus FO minus FE divided by FO, and ME, or the magnification of the eyepiece, is 25 divided by FE, similar to the previous formula. And this formula is called ME relaxed. There is another formula that's called ME, or the magnification of the eyepiece strained, by adding +1 to the formula. So what is the difference between ME relaxed and ME strained? This is done using the microscope itself. So assuming the figure on the right, O is the objective. So by looking through the eyepiece, the objective will be with that height. By doing a small shift to the right, it will be OS, or objective strained. It will change the distance from eye to eye bar, and also the height will be decreased, but the specimen or the object will come closer. This for sure depends on the configuration or the adjustments you are doing with the microscope itself. So if we are doing with relaxed, we will divide 25 by FE, and if you are doing strained, we will use the same formula, but we will add 1 to the formula. So assume L again is 30, FO is 40, and FE is 50. The exact value of MO will be 30 multiplied by 10 to convert from centimeter to millimeters, minus 40 minus 50 divided by 40, it will equal to 5.25. And ME will be 25 multiplied by 10 divided by 50 will equal to 5. And this is the relaxed formula. So the total magnification will be the product of them, will equal to 26.25. Now we have two different approaches to calculate the magnification of the objective and eyepiece, that are the approximate and exact. And for the magnification of the eyepiece, we have two different approaches also, by calculating the relaxed or strained. So we have 4 combinations. So consider a compound light microscope with an objective lens having a focal length of 4 millimeters and eyepiece with a focal length of 10 millimeters, and the length of the tube is 160 millimeters. We need to calculate the different combinations. If we have relaxed and approximate, we will just divide 160, which is the length, divided by 4, which is the focal length of the objective lens. And we are going to use the relaxed, so we'll divide the 25 multiplied by 10 divided by the focal length of the eyepiece. It will be similar values if you are going to use the same formula, which is approximate, but by converting from relaxed to strained, we will just add +1 to ME. So if the value was 25, it will be 26, and the total magnification will be 26 multiplied by 40 will be 1040. What about the exact? The exact, as we saw in the previous slide, it subtracts 160 minus 4 minus 10 divided by 4 will be 36.5, and ME will be the same value, so the total magnification will reduce from 1000 to 912.5. And if we are going to use the exact formula with the strained calculation of ME, we will just add +1, and the magnification will reduce from 1040 to 949. However, all of these 4 values are close to 1000 magnification times, so it does not matter now to use approximate or exact approaches. We have mentioned earlier we are going to magnify a specific specimen or an object. So what is a specimen? A specimen refers to a sample of tissue or cells that is collected from a patient for examination under a microscope. These specimens are typically obtained through various methods, such as biopsies and surgeries. The purpose of that is to diagnose diseases, identify abnormalities, and determine the nature of pathological changes within these tissues. There are different types of specimens. It can range from small tissue samples, such as biopsies, to large specimens obtained from surgical procedure, such as what are you seeing in the figure on the right. So if we have a specimen, what are the different steps that can we use this specimen through a biopsy or a surgery to be used under microscope. This involves several steps to ensure proper handling, processing, and examination of tissue samples. It starts by tissue collection, as we mentioned, from biopsies and surgeries, then fixation, processing, sectioning, staining, cover slipping, microscopic examination, interpretation and reporting, and finally archiving. So let's start by tissue collection. As you see in the title, it should be fresh tissue, and we are going to mention 3 approaches to collect fresh tissue collection. The first is biopsy, as you see in the figure on the right, and the tissue here are collected using various techniques depending on the location and the nature of the suspected pathology. This can include needle biopsies, excisional biopsies, and endoscopic biopsies. The second is surgery, and specimens obtained here are obtained during surgical procedures, and for sure they are larger and may require proper handling to preserve their integrity, as you see in this figure. And autopsy involves systematic dissection and sampling of tissues from deceased individuals to determine the cause of death or underlying diseases. The next step is fixation. Once collected, the tissue needs to be preserved to prevent decay and maintain the structure of it. Fixation stabilizes cellular structures and prevents self-digestion. There are different fixatives, such as formalin, which is considered the most used fixative due to its ability to cross-link proteins and stabilize cellular structures. There are also different fixatives, such as ethanol and zinc solution. And the duration of the fixation varies depending on the size and the type of the tissue, but it can commonly range from several hours to overnight. After fixation, the tissue undergoes processing to prepare it for embedding in a paraffin wax to be used later for a microscopic examination, and the steps in the processing involves dehydration in alcohol, clearing in xylene or other clearing agents, and infiltration with method paraffin wax. The dehydration process is used to remove water molecules and prepare them for infiltration with paraffin wax. After dehydration, tissues are cleared in a solvent like xylene or any alternative clearing agent to remove alcohol, which is considered a dehydrating agent and makes the tissue transparent. Finally, the tissues are immersed in melted paraffin wax, allowing the wax to penetrate and replace the clearing agent, and it can provide a support for the subsequent sectioning. The next step is sectioning. Commonly, microtomy is used to apply sectioning of the sample. So the paraffin embedded tissue is mounted on a microtome where it's sliced into thin slices called sections of uniform thickness. So you are determining the section thickness. It varies depending on the specific requirements of the examination, but majorly it ranges from 4 to 5 micrometers. In this process, there is something called ribboning, where multiple sequential sections may be cut simultaneously to create a ribbon of tissue sections for efficient processing. From that, we can obtain serial sectioning and serial interrupted sectioning. Serial sectioning is the procedure of collecting and mounting sections on a slide in the sequential order 1, 2, 3, and so on. And a ribbon here refers to the sequence of connected sections pulled from the microtome. So as you see here in the figure on the left, the first ribbon is section 1 to section 6, and this can be considered a block. And a second block or ribbon 2, it can be from section 7 to section 12 and so on. And this is called ribbon of sections. So on the slide, we are going to mount a specific number of sections. For example, on the first slide, we have section 1, 2, 3. On the second section, 4, 5, 6, and so on. So the first 2 slides are taken from the first ribbon of block A. What about serial interrupted sectioning? It's a procedure of collecting multiple ribbons of sections, each at different area within the tissue block. For example, ribbon 1 can be collected initially, and then after 200 microns, the second ribbon can be collected. This method of sectioning is ideal for capturing multiple areas within a tissue on a single slide, especially if we are going to apply sectioning on a large tissue. So on the figure on the right, the ribbons are similar, but section 7 here comes after skipping 200 micrometers from section A. So if you have a tissue like that, the first ribbon will be here, and after 200 or 300 micrometers, the second ribbon will be here, and the third will be here, and so on. In this case, the serial interrupted sections mounted on the slides will be like that. We will take from section 1, section 7, and section 13. On a single slide, there will be multiple sections where each of them is separated by 2 micrometers. So using a single slide, you can obtain an overall look on the tissue parts. After sectioning, we apply staining. This is done to highlight specific structures or components. The most common method is H&E, or what's called hematoxylin and eosine, and there are many other stains can be used for specific purposes, such as special stains for microorganisms or immunohistochemical stains to detect specific proteins. So hematoxylin or eosine H&E is a standard stain highlights cellular structures. It stains the nuclei with blue-purple and stains the cytoplasm and extracellular structures with pink. So if you look on the figure on the right, you will find the nuclei in purple, while the cytoplasm and extracellular structure in pink, like here. So now let's take some examples. As you see here, we can identify that this is the nuclei because it's blue-purple, and we can also identify that this part is cytoplasm here, here, and here because this is pink. And also from that, we can identify the structure of the specimen, and we can say this is a simple squamous or simple columnar or pseudostratified depending on the structure of the nuclei. So in these two examples, we can identify 3 things: the structure of epithelia, the nuclei, and cytoplasm or the structure. So the blue-purple parts here are nuclei, the pink here is the cytoplasm and structure, and from the order of the nuclei we can say it's a simple squamous epithelia. But on the figure on the right, because of the structure of the nuclei and the height and width of each portion here, we can say this is simple columnar epithelia. And this is also an example here. We can see in the figure a pathologist identified there are red blood cells here and nuclei, and both of them are in blue-purple while the cytoplasm in pink. How this is related to artificial intelligence? Before going to the depths by combining digital histopathology and artificial intelligence, as you see on the right, this is an application from a published study by Salvi et al. They use the HE images from different parts of the body, such as colon, liver, bone, prostate, adrenal gland, and thyroid, and they applied segmentation on it. And before going in depth about talking on the different segmentation techniques, segmentation simply here means we need to extract a specific part of that image. Here they applied nuclei segmentation. This means they needed to segment the nuclei. This maybe can be used to detect the structure of each nuclei, some features and biomarkers here. It depends on the disorder or infection. So some infections can change the structure of the nuclei. Instead of being an oval or a circle, it can be a different type of polygon. The count also can differ, and by doing that and segmenting the nuclei and then getting the biomarkers, this can be used to predict the infection or diagnose the patient using artificial intelligence techniques. So after staining, a cover slip is then placed over the tissue section using a mounting media to preserve the slide specimen and provide optical clarity. The mounting media can be watery or by using any organic-based mounting media. This is done simply by putting the specimen and then putting the mounting media and then the cover slip. The last three steps include microscopic examination. So the prepared slides are examined under a microscope by a pathologist or histotechnologist. They analyze the tissue morphology, cellular features, and any abnormalities present in the specimens. They then evaluate and make diagnosis. Next, they make interpretation and reporting. So the findings from the microscopic examination are documented in a pathology report, and this can include description of the tissue, any abnormalities identified, and any diagnosis or any interpretation. It can include additional information such as the grade, stage, and prognostic factors of the tumor. Then the report is then communicated to the healthcare provider responsible for the patient's care to provide the different treatment options and plans. Finally, archiving. Once the diagnosis is made and the report is generated, the slide and any remaining tissue are typically archived for future reference. Proper storage conditions such as controlled temperature and humidity are maintained to preserve the integrity of the specimens. And here we are, digital pathology. So digital pathology systems are used to scan and store the digital images of a slide for remote viewing and consultation and research purposes.